watching and listening to Sun FM TV.
Iconic music.
Good morning to our lovely listeners and viewers of Sun FM TV. Welcome to today's edition of Health Talk. With me, your presenter. My name is Lamek Zulu, professionally known as Four Legs, hashtag the servant of the truth. Today, we have a very good topic on this program, and I'm glad that you could join us because it's very important that we discuss pre-eclampsia. And this is a very, very important condition, especially for pregnant mothers. So as part of the ongoing commitment to maternal and child health, we are focusing on this particular topic. Now, this Thursday, the 22nd, and advocating for improved care and early detection of this serious pregnancy complications. So I'm sure women folk should be tuned in right now so that we can learn more. So to help us better understand this very Dr. Msonda Mtale from the Department of Obstetrics and Gynecology to help me dissect our topic of discussion. Dr. Chungu, good morning. How are you?
Okay, thank you. I'll go first.
Yes.
Yeah, so, like you alluded earlier, so preeclampsia, this is a medical condition that is found in pregnant women. So this may be the first presentation where a woman, when becomes pregnant, then develops an hypertensive disorder. Now, this is an hypertensive disorder in pregnancy, which is special in terms of its presentation. So it will usually occur after a woman is 20 weeks. In months, then it will be about 5 months. So now, how it presents is it will have other symptoms that it will carry with. So the BP will be raised, so the doctor will tell you, no, the BP is above 140/90, which will be recorded in 2 occasions. What I mean, 2 times, at least 4 hours apart. Then for it to be preeclampsia, it needs to have other evidence of end organ. One who have raised BP like 140/90, above 140/90.
That we're discussing.
Okay, the condition is fairly common. When we talk about worldwide statistics, we're talking about a 2 to 8% prevalence rate. If we talk about WHO, it's about 2 to 10%. And however, at our hospital, we seem to be recording more cases of preeclampsia recently, in the recent past, in the last 1 or 2 years, which I think the only problem is we don't have the actual statistics. I think so far from the admissions, the number of patients that we're seeing, we could be actually at 30%.
Then, to prevent now this occurrence of preeclampsia in the current pregnancy that the woman is carrying, a woman will be put on certain medication like aspirin after. This is very minimal. It's not the same as the one that they take when you have got a headache or toothache. Just about 75 to 150 milligrams. So when you start taking aspirin as early as 12 weeks, then the occurrence of preeclampsia will be reduced, but it's not 100% to say you won't have preeclampsia. So you can use aspirin, you can also use calcium, which has it to say you can use.
Systemic diseases, autoimmune, where your body produces antibodies to attack you. You look at SLE, which is systemic lupus erythematosus. They also look at antiphospholipid syndrome. So those diseases are high risk for developing preeclampsia. So when you talk about the risk being recently developed to assess what risk a woman has of developing preeclampsia, and if they have preeclampsia, what is the risk of even up to 7 days. So you look at PrEP-S, and then you look at FU peers.
Yes.
So the FU is in small letters, peers in creatinine, the AST, the liver enzymes, the AST, ALT. You're looking at the platelets. You're looking at the HB and all those.
Or 30 or 35, those who are the woman on the bigger side. So if she comes and she finds me in the antenatal clinic, I would advise her to say, Mama, your weight is on the higher side, so you're likely to develop hypertensive disorder, probably preeclampsia. So I'll put her on aspirin 75 or 150, but that does not mean she won't have preeclampsia, because it's not well understood how it comes about.
Okay, I know we did touch a little bit about the symptoms. We spoke about is it vomiting? What are other symptoms, Dr. Mtali?
Or they may come in and working on the platelets are also going to be low. Yeah, other than that, those are so of course with all those, you look at the GIT also, the patient is going to be vomiting, like I either mentioned. Vomiting is twofold.
And cure.
Yes.
So that's why we're talking about this thing. That to a woman who had experienced hypertensive disorder in the previous pregnancy, please report to the hospital as quickly as possible before 12 weeks. Because if you come later than 12 weeks, for example, you come after the pregnancy is five months. So meaning the prevention that I've been emphasizing about, or I've been emphasizing on the issue of taking aspirin 75 or 150 milligrams. So when a woman is told to say you have preeclampsia with severe preeclampsia, especially with preeclampsia with severe features, where there is evidence of end organ damage, the woman should deliver within 24 hours. Should we do forced labor? The woman who comes, she's got pulmonary edema due to preeclampsia. So you want, so you try to deliver this woman quickly by cesarean section. Now there's so much myth surrounding a cesarean section with women. You know, every woman who comes to the hospital they want to deliver normal, but when a doctor tells you to say you need to go for a Caesar, there must be a reason behind it. So ask, why am I going for a Caesar? So it's not just that when you come to no teaching hospitals, it is well known condition, and try to prevent the outcome, the bad outcome, either from the mother or from the fetus itself.
I know you've touched on a number of complications, Doc. Are there any other that you'd want to add, Dr. Mtali, apart from what he has said? Other complications that may come with?
The thing we always try to prevent is eclampsia itself. Like he alluded to, meaning before eclampsia. And eclampsia is basically convulsions as a result of hypertensive disorder in pregnancy. Yeah. So the first thing will be convulsions. Yeah. And then related because of the condition. So you may have subcapsular hematoma, meaning under the cups of the liver, under that skin that covers the liver, you may have a patient bleeding under there, or you may just have hepatic congestion, too much fluid in the liver, and then the capsule can't hold that pressure. Hepatic failure, hepatic rupture, acute kidney failure, chronic kidney failure, stroke, then HELP syndrome. Yeah. Basically, those are the complications.
So, Dr. Chungu, let's talk to us about the support system.
The high level is a tertiary hospital is to make sure that these women with these complicated pregnancies are way to come to this hospital. Because if you go to Kaloko Clinic
facts on the ground that this is our second leading cause of maternal deaths in our preeclampsia in all its severity. Like preeclampsia has been highlighted, especially by engaging us, the relevant doctors in the actual field. This is to bring global awareness to this cause of a very preventable cause of maternal death, and ultimately Bella Teaching Hospital to go and mentor the health personnel from local clinics.
Okay.
We mentor them on emergencies, obstetric and gynecological emergencies, and we are assured, we have information that the nurses are doing a good job out there. So the woman who's coming to us 9 months pregnant, the pregnancy is very small, and swelling of legs, which is acceptable in pregnancy because it comes with the physiology of pregnancy.
Okay.
But then there is an excessive type of swelling where women should be concerned. How come if in the Monica they are every day, then you find somebody wakes up late. Sometimes certain things can be missed elsewhere, but they should know danger signs in pregnancy. The baby is not growing well, the baby is not moving, headache which is not resolving, Panadol is not resolving, it's just there. Then you look at the issues of swelling, excessive swelling. So it is a very significant day because it brings awareness, it brings maternal death. Like I said, that in our facility, yes, we do have people dying from hemorrhage, but at least it's much better now than it used to be. So most of the times when it's hemorrhage, we are able to control that. But then when we have a woman who comes with preeclampsia, with the end organ damage, the liver has failed, the kidneys have failed, we can't do anything to reverse that process. So it is a very significant day because it highlights just how much of a burden this is, especially in our environment where we are seeing this with a prevalence which is actually more than what is highlighted in the books. Maternal and neonatal poor outcomes.
So, me coming from
Out to understand the burden, and the pregnancy came about because there was an agreement. So people should be involved and take responsibility. So now, the woman comes. This one, Papa Pena Caesar, then the second one normal. Then this is a woman who only went for antenatal once. And she comes in labor. So having a talk with her, asking her, what was happening? Why were you not going for antenatal? Say, no, I've had problems throughout. But within the conversation, you have time to... Mama, you quite any preeclampsia with severe features. Monen, imistashire fuma, muanatalekula. Please, let's intervene before things go to waste. But the response that we get is, let me call the man of God. And 1 hour to intercede. That woman won't make a decision. And majority of the cases, the maternal outcome and the fetal outcome is not good because we delay. And the blame comes back to the hospital. So the clergy, the papas, the pastors, and everyone who is involved, the relatives, antenatal care. Antenatal is very key. Antenatal is very key, and most of these diseases will be prevented. So I emphasize, please, the clergymen especially, if you're advising this of your congregants, also have time to chat with the doctor that is seeing this patient. Ask around before you. Most of the cases. Yes, actually, we have got such cases where next time you go and see the client, all the water is there, and tells and to make matters worse, if things go contrary to what the doctor was advising. For example, if a woman tells, you want to go let's go for Caesar, you can, there will win. The papa there will win, yeah. But my emphasis on this point is community sensitization is very key.
It's very
Please,
key.
every one of us should be involved. If I see a pregnant woman on a bus, if I see a pregnant woman on a bus or in a car or just along the road, please, let's take interest and ask them, how are you? Where are you going? How many antenatal visits have you had? Do you have any issues? You never know. You can help this mother to have this preeclampsia, which we are talking about, to be detected early, and interventions can be put in place and avoid the bad maternal and fetal outcome.
Okay, Dr. Mtale, you did talk about communities to preeclampsia.
Okay, I think we have a long way to go as a country and as a province and as a Ndola district. We really have a long way. We could do better in terms of support that we offer to these mothers with who have preeclampsia and who have had pregnancy losses from preeclampsia, because it tends to recur. There is a percentage of recurrence. So I think we could do better in terms of support, to have a support system for women who've suffered adverse outcomes from preeclampsia, especially those who've ended up with chronic conditions like kidney disease, multiple pregnancy losses and all. But for now, they have every morning before antenatal, they have like a playful thing where they sing songs. When we went to New Masala Clinic as mentors under King's Global, they would sing this song to say danger signs in pregnancy. Danger sign, umutwe, kufimba. Women who are pregnant, and they have a register where this woman is found. Sometimes they do follow up in the local areas like that. Yes, but the concern, I guess, would be if we had this computerized system where, okay, this woman has registered, it flags she's a previous Caesar or she's a chronic hypertensive. We're able to pick, there's this woman who's a high-risk patient, where is she, why is she not coming? I think he has basically highlighted the main things that we need, because even when we look at the maternal deaths, we look at maternal, we have 3 delays that really contribute to maternal deaths. So we have the delay of woman accessing or one antenatal visit, and this woman is a previous cesarean section. This woman had a previous abruptio or was bleeding in the last pregnancy, and the Caesar was done. Then they come, they've never even done a scan. They are in labor. Sometimes the women are finding out in labor that they are carrying twins. They're finding out when they deliver that they are carrying twins. So in this day and era, really, I think we can do better. Yeah, I know